Hi, I'm Dr. Neil Gordon, and this is another in a series on setting the record straight, the truth behind your questions.
When should I look into Botox?
In the last 5 years, we've seen an explosion in a new type of treatment modality, that being facial fillers and Botox. Facial fillers such as Juvederm, Restylane, Sculptra, and even our own fat have an important purpose in the treatment of the aging face. But because they're relatively inexpensive, they're minimally invasive, they're easy for any provider to do, they're readily available, but we want to understand what they do and what they don't do so you understand how to use them correctly. Today, when I go to a restaurant, I'm more apt to notice inappropriate facial fillers as the reason why somebody looks obvious that they had a recent plastic surgery procedure. For the same reasons we don't want to have obvious facelifts, obvious injections can be avoided. Let's take a moment and understand how Botox works. Botox, which is botulism toxin, has been used for decades for medical purposes. Botox, which temporarily paralyzes muscle, has been used in the medical world to limit the use of muscles that were overactive. We then started to understand that there were cosmetic uses for Botox. As we know, facial aging is mainly due to gravity's effects, and time going by, putting it bluntly, is a stretched out face. When this occurs in the lower face, it's very obvious, and we don't do anything to mask it, and that's why we get jowls, and that's why our neck changes. But this also occurs in our upper face, or our forehead area. The reason we don't like a furrowed forehead is think of the emotion that's connected to it. When we're angry, or we're aggressive, or we're serious, we use our forehead muscles to express that. So when a furrowed forehead is there, not because we're angry, not because we're serious, but just because our forehead is loose, it creates an emotional appearance around our eyes that's not consistent with the way we feel. So now we can understand when Botox will work and when it wouldn't be ineffective. In the early stages of aging, the forehead hasn't fully stretched out yet, so the furrows that are there can be relaxed by Botox. Botox will temporarily paralyze those muscles, the forehead will smooth out, and there won't be any negative effects. This tends to be perfect at around the 45-year-old stage. The issue is when we use Botox on the significantly changed forehead. When a person has significant neck changes, it's usually a sign that the forehead is stretched out also. So now, if we paralyze those muscles with Botox, what will happen is the furrows will go away, but because the forehead is significantly looser, the forehead will droop down and start to cover our eyes. It's not uncommon for me to see a patient who's had a recent Botox treatment, and although their forehead is smooth, they complain to me that their eyes look very, very heavy and small, and they feel this is a complication of the Botox treatment. It's not a complication. The Botox is working perfectly. It's relaxing their forehead, but because their forehead is now too loose, it is unmasking and covering their eyes. At this point, Botox is not the right choice for them. This is Dr. Neil Gordon, and this was another episode of Setting the Record Straight, the truth behind your questions.